Today we are joined by Dr. Prateek Arora. He's a senior clinical fellow at the Christie NHS in Manchester, with a background in surgical gastroenterology across India and UK. He brings sharp insights into how patient care and surgical practice are evolving in healthcare, specifically around patient experience. So, Dr. Arora, would you like to add anything in your introduction?
I think one of the things that I'm going to add here is thank you, Jatin, for this opportunity. And I just want to give kudos to you. You have been very professional up till now, and I had a very good experience in getting up to here. So yeah, I think it has been an over a decade of surgical experience for me. I was a consultant back at AIG hospitals in Hyderabad, India, which is like one of the most premier gastroenterology institutes of the country. So I always pay homage wherever I am at to my parent institute, and again, it's doing massive leaps and bounds in the AI sphere as we talk about that today. And currently, I have been doing a fellowship in advanced pelvic surgery and peritoneal oncology at Christie, Manchester. And this is again a very good institute in itself. So yeah, I'm very proud of the places that I have been. And thank you for having me here.
Thanks, Dr. Prateek. So, with that, I would love to ask and get into the first question. So, uh, there has been a lot of things going on and discussions about AI in healthcare, and there's a lot of fluff also. What do you think the role of AI is going to take in healthcare journey specifically?
Um, I'm very happy with this question because there are two ways we can discuss regarding those things. If you start discussing the nitty gritty things of about anything, the amount of changes in the healthcare and anywhere in the world that AI is bringing through is massive. But if you think overall, considering the history of medical sciences and everything, most of the development in medical sciences has been through physics and science, as it has been for the whole world. When
Yeah,
CT scan came, when MRI came, they changed the healthcare. When anesthesia came, it changed surgery. If you think about AI, it's just not a small thing that we are discussing, that a small thing is happening, how it's going to change. It's a massive thing. And
absolutely.
there are people who are telling what AI means. There have been forecasts that the changes in AI and the changes in tech in the next 30, 40 years is going to change 400 years of history from here on. So, what I feel in its entirety is that AI is such a massive thing that it's not going to bring a couple of changes in healthcare here and there. It's going to completely overhaul everything, including the healthcare. And I think we are at the baby steps discussing of how we can start taking it in. So I think, yeah, that's about it. So AI in healthcare is going to completely change it throughout. And there is going to be a short-term things into it, I think, which is mostly that we are discussing today, which is going to get implemented and what we are seeing in front of us. And there are going to be some very long-term changes, which I think is out of the scope for this podcast. It is out of the scope for most of our understanding, and even I would say that I would not be commenting on all of.
Definitely. So there are a lot of upside on AI. Like if we look at the potential, growth it can have in the healthcare sector. But in continuation to the insight that you gave, I just wanted to understand what do you think are the short-term changes, or maybe the quickest changes in healthcare that you see or that we are looking into?
Um, Here, I think the biggest change or the earliest change that we are seeing right now is actually deeply rooted in the rut of healthcare system right now.
Hmm.
Um, I can just start speaking and won't stop, and I don't want to do that. Rather, I'll give you a single example, and which I think if anybody listens to it, they get really an idea what's happens. The healthcare is on another level, the world is on another level, the accountability associated with that is on another level. Let me give you an example how we see a patient in clinic. If we get a clinic of around 3 to 4 hours, we are able to
mm,
see approximately 6 to 8 patients only in the NHS at present. And out of
mm,
them, only 2 to 3 are face to face patients. If we have to see a patient face to face, let me give you an idea. If a patient is booked for today at 8 a.m. in the morning, let's say, or like 9 a.m. in the morning, before that clinic, I have to go through the system to read through the files on that patient. Everything is
mm,
haywire. There's like
mm,
thousands and thousands of notes into it. I try to read my previous letters. I try to read through some of the notes, previous conversations. It takes 10 to 15 minutes for me to get an idea of what's happening with this patient, where we are at with that patient, and what
mm,
is going to be the agenda of meeting today. When that patient comes and meets us, we see the patient, we examine the patient, we talk with the patient, help them elevate their anxiety, plan in the future, and we talk about for like say 15 to 20 minutes, 25 minutes.
mm,
Once they go back, we fill the form that what has been done for this patient today.
mm.
We order the request, which take around 5 to 10 minutes more. We put down a letter which goes to the patient and to the patient's referring GP, which takes around next 10 to 15 minutes. All
Mm.
in all this process takes around an hour and a half if done properly for one single patient. And
That's too much. Yeah.
in that time, the time taken to actually see the patient and actually interact with the patient is only half an hour or even less.
Mm,
It leads to a burnout not only of the doctor, but of all the people who are involved into those systems. Writing,
mm,
dictating a letter for 10 minutes, which has been written by another personnel, our secretaries, for like
mm,
half an hour. Then they send it back to us so that we can correct it. Then it goes to five different people. This current rut is leading to a doctor and kind of a burnout, not only in doctors, but in nearly every other individual which is associated with healthcare, including patients. AI
mm.
can solve these things like this. They
Absolutely.
can summarize what has been happening with this patient. There are current applications which we switch on during our clinic appointments, and they hear what the
Mm,
conversation is going on, and they just summarize things. They write the letters themselves. They go down directly to the patient, and you just have to check things. So if
mm,
you reduce the timing, and clinics is just an example, if you reduce the timings of everything associated with it by like 50%, it's a massive win-win. You
yeah.
The number of healthcare personnel involved in all of this comes down massively. And it's just an example, but it just tells you how at present AI can help us massively.
Definitely. And also, like when I spoke to a few surgeons before, so it's yes, it is definitely physician burden, but due to the time that is being spent to diagnose one patient leads to the wait times to another patient also, right? Who are
Absolutely.
sitting in the line, right? So going into that from your experience, because we have heard a lot of points like on the internet from the technologists or the people who are in technical stuff like me, but a very few voices are clinical. So I just want to understand from your experience, what are some of the biggest gaps as a doctor you see in the patient's journey from, let's say, diagnosis to a recovery phase?
Right. I think right now, what your question actually means is that if we say what are the present gaps between diagnosis to recovery, what we are really talking about is a patient's journey in the hospital. And
Exactly.
first of all, if we answer the first part of that question, what the real gap is, we can say that there are long waiting lists, but that's preclinical. Once the patient comes to the hospital, I have a massive respect for the NHS, the way they are treated,
Mm,
the way they are made felt, and everything. The patients who are leaving our hospitals are very happy, at least at my
mm,
center where I'm working at. The
yeah.
biggest gap that I would say that every patient says, and if you are a patient one day, you'll realize that as well, is education.
Mm,
Education about what's happening with them. When is that going to happen? How is that going to happen? And they need a holding hand with the patients throughout. So for example, if I see a patient in clinic, the patient gets admitted and the patient knows that I'm going to get operated, or let's say the patient, So in today's era, the patient directly come for surgeries on the morning. So if the patient is knowing that he's going to get operated 2 weeks later on from here on, so the biggest worry for that patient is, what do I need to do in between? Do I need to do this? What do I need to expect? How long is going to be my surgery? When do I need to come? What do I need to eat? What medicine should I take on the morning of surgery? What dress should I do? Should I use soap? What should I not do? And when I come, how long is going to be surgery? After surgery is going to give me a call. How long is going to be my recovery? After recovery, how many days can I not drive a car? Is my insurance valid? So if you get the gist, you realize that patient would have 50 questions on the top of his head like that. And if
Mm.
he keeps thinking, he's going to have thousands of questions more. If we filter down
Absolutely.
those questions throughout the process, I'm telling even when the patient is admitted with us post surgery, day first, he will have 100 questions like this. What can I eat? What can I not drink and everything? And if you think about it, out of these 1,000 questions, 950 are trivial questions which can be answered very simply. At present, you
Hmm.
need a person talking to someone else, you need to book appointments, and they need to write down their questions. But in reality, as we know, we keep getting questions. So at present, if we see 50 years back, people were not even having Google. Once they
Yeah,
have Google, people search everything up. And at present, AI is the new Google. We can have
exactly.
healthcare assistants which can actually, if you feed all the answers once, it has the intelligence to understand more than just answering a simple question. You know,
Mm.
the multimodal AI can understand language. They can understand what this patient is trying to ask.
Mm.
These patients can be supported throughout their journey, pre-clinic, clinic to surgery, surgery to post-op, and even post-op with the help of AI apps, which can tell them what is going to happen with them and can answer most of their questions. And I think
Mm.
patients are going to be much more satisfied and happy. And I think
Mm.
that's one gap which the NHS does a perfect job for it. For example, NHS has
Mm.
a clinical nurse services. They have CNS, they have special pre-op nurses, they have speak up team, and they have a lot of personnel who are there to help out the patients. But to be very frank, just a single app can actually
Mhm.
do much more in this journey. So I think that's one gap that is very apparent in front.
Definitely. So, in this whole space, I think the doctor-patient relationship is also important, as you also mentioned the patient education, right? A lot of questions about that. So, I just want to get into that. How do you see AI evolving in a way where it fits this current system and where it fills the current gap that basically we have spoken about, that strengthens the doctor-patient relationship rather than replacing the doctor, because there is a lot of fluff around whether it will replace the doctor or not, how the whole future looks like. So what are your thoughts on that?
I'm very bullish and positive on that point. Let me say that even when AI wasn't there, whenever I was seeing patients, I used to tell them go and Google stuff. So apart
Hmm.
from just only one problem, and even I don't have a problem with that. They say people googling their own symptoms and then coming and
Hmm.
causing problems, and they are self-diagnosing that has been a problem.
Yeah.
Well, whenever you are trying, it's like it's like development. It's like a river. It flows. You try to stop it, you cannot stop it forever. You thought you would be
Hmm.
able to stop people from googling their systems. That was never the future. And now we have AI, and you'll see in some coming days that people will say, like what I'm saying right now, please use AI in self-diagnose and everything. So I think, what's the basic goal of healthcare? Is it not really saving patients life, getting earlier diagnosis, getting superior comfort to the patient? Because at the end of the day, every doctor is a patient as well. At some point of time, we all are. So, what I'm trying to
Yeah.
say here in its entirety is a better patient care, earlier diagnosis, a better treatment always helps the doctor patient relationship. If a patient is happy, if the patient is getting better care, I think the doctor is going to be happy and the patient is going to be happy. Uh,
Absolutely.
just to give you an example, if we take this into clinic, or it's like if you take this patient between patient doctor relationship, if if a patient uses AI app to see what my
Hmm.
symptoms are, what it could mean. We could see self-diagnosing could be a problem. But if the patient asks what these symptoms are, should I go to a doctor and who is the doctor I should see to? Can you see the
Exactly.
positive in that? If the
Hmm.
patient knows that this is a problem and AI says this is probably a liver problem, you should see a medical gastroenterologist, you should see a hepatologist.
Hmm.
And we know there is a system of GP here, but we can go into a future where and we are aware where there are AI apps replacing these transfer pathways.
Hmm.
If they get connected to the right kind of doctors, tell me it is not helping both the patient and doctors. That's one.
Definitely. Hmm.
And if the patient is present in front of the doctor and they have a chat and doctors tell you this is your surgery, as a part of surgeon, I tell you this is your disease, this is your surgery. And I
Hmm.
tell them for half an hour main things, but I tell them have another clinic appointment with me in like 1 week before your surgery because you'll have more doubt. They go back home, they use AI apps, and it tells you what to expect in surgery. And they come back and tell me, and they have solved all of their trivial questions, but they have 10 intelligent questions which they really ask the doctor, and I'm able to help out with those 10 intelligent questions that you're right, this is going to happen. And let me tell you, out of those 10 questions, two questions will help me to introspect and to let me know the things that I would have missed in her case.
Exactly.
That, okay, we
Hmm.
can do this as well. Yes, I can do this as well in your recovery. Tell me it doesn't help the patient doctor relationship. Same goes for recovery. So I think that's my argument there.
Definitely. I mean, the getting the right care, like at the right time with the right information is a must, right?
Yeah.
Looking at the diversity of the healthcare also, because healthcare, I believe that works differently in the different regions of the world. So synchronization of all of these system and centralization of healthcare will bring a very good positive upside to this entire system.
I would like to add another point here. The last thing that I just spoke about connecting the right patient to the right doctor, we don't think much about that here in the UK because there's a GP
Hmm.
system, but we know
Hmm.
that the GPs are getting really overloaded with their stuff.
Hmm.
The
Yeah.
amount of paperwork that they have to do is making GPs crazy. I wouldn't bet on it, but like I have an idea about that. And number two, there has been a sustained and what we think is going to be progressive increase in the private healthcare setups in UK as well. So
Hmm.
I really expect there's going to be a time when you can really meet the doctors that you want, as it happens
Hmm.
in large part of the Indian subcontinent and other evolved private setups around the world. And with
Hmm.
the more globalist kind of society, and we can see most of the patients for a lot of kind of surgical procedures doing a global surgical shopping, going to Turkey for
Hmm.
their hair transplants, going to Indian for some kind of um, other surgical procedures. So I think a globalization is going to take a key role into it. So it's going to be useful even in the UK system as well. That's what I'm trying to say.
Definitely. Uh, Moving on to my last question. So, what excites you most about how AI might shape the future of, let's say, surgical care specifically, if you have to say about?
If you don't mind, I would like to answer two different questions here because I
Definitely.
really got excited with your last question. What excites me is the future of um, AI in surgery as well as AI in. And first, I'll answer that, and after that, I'll also answer what excites me with the future of AI because I'm really
Hmm.
excited about that. And yeah,
Definitely.
I will get into it. So, if you talk about AI in surgery, especially in my branch, I think it's already in.
Hmm.
Um, we in UK at least we are very bullish with robotic surgery and especially all over the world. If I go back to my Indian subcontinent, I cannot imagine a single major metropolitan city where robotic systems are not there. They're all there. They're
Hmm.
all over there in the world.
Hmm.
And with robotic surgery, if you're not aware, we are currently doing telesurgery. This has been done at least a decade back, where you are sitting. So, what robotic surgery essentially is, it's like a keyhole surgery. You have small holes in your belly, and we have ports in, and we set up, dock the robot on your body as a patient, and they have their arms in, and we sit and on another console, and we operate with the help.
Hmm.
Now, the good points with that are there are a lot of good points, and there can be a lot of debate that goes into it, but we are able to do a very good flawless kind of a surgery. But You can operate on a patient continents away. This
Hmm.
has been done. And at present, they are operating in tier 2, tier 3 cities in India, where they're sitting in one city and operating on another patient. So when you have the robot docked to a patient, it's like the physical framework already been there. And you
Hmm.
just have to add AI. And then you have to see what levels to AI you can add. As surgical perspective, again, in preoperative clinics, in there are thousands of research papers that tells how this patient is going to score in this surgery, what is this anatomy like, what you are going
Hmm.
to expect, and everything. But it's very difficult for you to consolidate all the knowledge in the world with the help of a single surgeon into one patient. But AI can do that like this. So it can consolidate all that. These are the things you need to worry about this patient. This is his anatomy. These are the things. While you're operating in the robot, there
Hmm.
are techniques available which can superimpose CT scan images and MRI images with your surgery. So even if you cannot see the tumor inside, there is an overlap of your images with 3D vision where you can see the tumor is supposed to be there and I need to go there. So that's very exciting. And I'll tell you one more important bit as well.
Hmm.
With
Yeah.
robotic surgery, we are able to do such flawless surgery, like sometimes a blood loss in a major bowel resection is less than what you give out in a blood sample.
Hmm.
These patients who used to get admitted for 7 to 10 days after surgery, they came down to 3 to 5 days, and now we are even able to do these major bowel cases with robot as a daycare surgery.
Hmm.
We send them home and we call them twice a day for the next couple of days. This is as present happening in the NHS.
Hmm.
And if there is any problem, we can call that back in, because out of 100, only 2 or 3 patients are going to have problems. Rest 95 and 97% are going to sail through. See the massive amount of savings that it gives the NHS and the healthcare system. And
Yeah.
the AI can do all of that. The AI can follow these patients up by themselves. So these are really short term technological advances which are happening in the AI. With endoscopy, even if you miss with your eyes, the endoscopy is able to detect that's a lesion that you have missed.
Hmm.
And if you start going into AI
Absolutely.
in different different branches, yeah, it's everywhere. And I'm just talking about the short term here.
Hmm. Absolutely.
And if you like, I can talk about one thing and the long-term context as well with AI and technological advances. Just because if anybody is listening to it, they realize what is going to happen. And this is a little
Sure.
bit close to my heart because I'm very drawn to it and everything. So AI we know what AI is. AI can read your language, it can process information, it has machine learning and everything.
Hmm.
So these things, just to give you a very brief example, there is a lot of things going on in research. Everybody publishes research and there is a lot of research papers and everything. Research is based upon data, and you analyze that data and then you write it up. Research
Yeah.
process has become probably much faster with the help of AI. As we all know, there are different kind of researches where you have to research on like 70 different publications from all around the world and see what is the gist that it's provide us. For example, let us say systematic analysis and meta-analysis. Now even if you have to do that, a team of researchers have to sit on it, make Excel sheets, fill the data, and then do the statistical analysis and then analyze the data and everything. It might take them from a couple of months to a year. Do
Hmm.
you know a proper AI who is like made for that thing would take a couple of minutes to do that?
That's very,
That
yeah.
that's not even a 99% difference. That's probably 99.9% difference.
Yeah. Absolutely.
That's like we are looking a decade ahead. We are coming to a place where quantum computers are coming in.
Hmm.
If we want to detect, like just in a layman's term, if you want to know how two molecules work, that can be done with your mobile phone. If you want to see what is going to be a pattern of how four molecules are going to behave in a chemical reaction, this is complete layman term explanations. It's
Hmm.
probably going to take a supercomputer of the world to do that. And if you want to see how 8 molecules are going to react in a chemical reaction, a supercomputer might take trillion of years. That's kind
Yeah.
of gap, and that can be done in minutes with the help of quantum computers.
Mm. Yeah.
Quantum computers has the ability to do research bypassing animal tests, bypassing in vitro tests. It can
Mm.
create and work on models because of the basic difference. It's because it's not bits, it's not zero or one, it's qubits, and it can be anything at that given point of time. So it can do research to a different degree. And as I was talking in the initial part of this podcast, the reason I am able to do the biggest surgeries known to mankind and not doable 100 years back is not just us, it's not the surgeons, it's the anesthesia.
Mm.
That gives us
Yeah.
the ability that the patient stays stable, and the new technological advances, the CT scan, the MRIs, the cautery, that we can do this. So we
Yeah.
as surgeons cannot take much credit for it. It's the research that really shapes mankind. There are 10% of colon cancers which are now completely dissolvable with the help of immunotherapy just because of the research which has been done in the past couple of decades.
Yeah.
With the research of that level in the next 30, 40 years, as patients, as humanity, we don't want surgery. We want is cure. So, and once AI and these quantum computers and this tech takes on research and takes it to the part of cure, that's why it's very difficult to predict how 40, 50 years are going to be. And what we are doing here, I think, today is discussing the next 10 years. Tell me if I'm
Yeah.
wrong. I don't know.
No, no, definitely. I think we know that there is a very high upside on specifically about AI and modern technologies, what it can do. And I
Yeah.
was actually like I liked one point. Like I mean, I liked all the points, but there was one point that I like also relate with, which is like uh, since AI has a knowledge of almost every use case or almost every complex case of the specific healthcare AI almost have a use case knowledge. It can basically predict as well as guide the complexities to a surgeon or to a doctor that this might be the possibility. So the knowledge of possibility towards, I mean, patient education is important, that as a patient I can get information about, okay, these are your problems, but as a surgeon also, just like you mentioned, as a doctor also, that okay, these are the possibilities that might happen during the surgery, or this might be, this has happened before in this particular use case. So those both
Absolutely.
of, so it will be basically benefited on both of the sides, not just the patient. So that is what I just wanted to mention.
No, you're absolutely right. And one thing I would like to reiterate or kind of a take back, it's very easy, and especially for me to say that the future holds boundless possibilities and everything, but things take time. If you come back to reality, things take time. I
Yeah.
I don't think so. As doctors, we are losing any jobs for the next decade or so. And I have to
Mm.
say that I'm very happy being a surgeon. I don't think so. I'm going to lose my jobs to AI for the next 2 or 3 decades or so. So
Mm.
kudos to your team and everything for taking a lead on to AI. I think that's absolutely the best time right now to take a lead on it, because yes, that's the future. And all the healthcare systems and everything are going to benefit massively from AI. And I think yes, that's going to be the future, at least for next 10 to 20 years, 30 years, let's say.
Sure. Definitely. Well, thanks, Dr. Prateek. It was great speaking to you. Great having you on the podcast. We touched upon really great topics, and this whole conversation was really insightful. Thank you so much.
I would like to thank you a lot for giving me this opportunity. It's always a pleasure that to have a platform where you can really speak out of what you truly feel, and
Yeah,
let's see what the future holds.
sure, definitely.